1.2 lakh rupees to come here, leaving their practice. Your brilliant brains are sitting here. In case you ask one question each or two questions each, your OPU is done for life. So whatever we say, assimilate it. Just think what you have. You don't. There's a difference between hearing and listening. Hearing is 22. How many? What is that? 20K. 20K. And what is listening? Listening is when you are hearing and assimilating whatever you are doing. So please ask questions. As you're working, ask questions. And the two of the questions we have already done. Anything from your side?
Sir,
identify yourself. Always for everyone, tell your name.
Sir, I'm Dr. Anita Naik.
Yes.
Sir, first of all, we'll load this needle with the medium and then attach it to the probe.
Again, Anita, the term called loading is wrong.
So
you are eradicating the dead space. So now your term should be different.
Okay.
So you can say it flushing, but even if you flushing is not the correct word.
Because
you say
is like putting from
flushing.
with the pressure.
Filling the
Here you are eradicating the dead space. Eradicating the dead space. See, whatever we do, it is the same thing. We all do good work, but the right language will make you a better doctor in long run. So we are doing
emptying the dead space.
We are removing the dead space by using 2 ml of
medium
culture medium.
And then putting the
that should be preheated culture media. And what culture media we use? We use a HEPA's buffered media. We don't use bicarbonate media. What other things can flushing or removal of dead space do? What all things are done with that? One is we avoid the cappuccino effect. What else is being done there?
Temperature of that needle.
Temperature.
Equilibrium.
Good. So Jyoti, excellent. Temperature which may be slightly low, temperature goes to 37 degrees centigrade. 37 degrees centigrade. What else? You guys, pressure will be depending on the machine. What else?
Laminar flow we are ensuring because now there is no.
You are coating the needle with the media so it gets lubricated. Needle lubricated. It's got some proteins lubricated. What else?
Then that jerky movement of.
No.
Any infection?
No.
Any
infection won't be there. So in case there is so many VOC deposits, because they are traveling. See, the needle comes to you from Denmark or from Australia. The needle is coming to you at very varying temperatures. So when they come to you, probably polyethylene tubes are generating some VOCs. So when you just wash it, all these coatings, VOCs will get washed out. Maybe when they are preparing your needles, there are some debris inside the needles, they'll get washed out. So that's the importance of flushing.
Flush it and then we take
No. Just careful.
Flushing is a method by which we eradicate the dead space.
yes, dead space. But
Yes.
that fluid, in that same fluid we'll correct the
No, the tube will change.
yes, that's what
So what you did now, sometime back, you were doing this. You got 2 ml of fluid in that. You say, coming, aa gaya. Put switch off, and then you change the tube.
yes, that's why
That assistant will do.
Yeah. They put a new tube. That's all. And it's a play off. It's basically a very beautiful thing. The silicone bunch will fit inside very tightly, and then the moment it is done, just take it out and put in the new tube.
so at least 2 ml of fluid should drain and then we should, if we want to pass on
Again, Sunita, we have to know term is between 1.2 and 2 ml is a dead space. Depends. Some needles may vary. Some needles may vary. You saw the needles here. Some needles may vary. So we say average 2 ml. Now 2 ml means जैसे drop गिरना शुरू हुआ, don't stop. Let 7-8 drops fall, and that 2 ml of fluid should come in around 1.5 ml of fluid. It will flush. That debris should also come inside. अगर हम ऐसे नहीं करेंगे तो क्या होगा? In case there was some irritants in the needle and the tube, I'm just assuming. And the moment 2 drops come, you stop. So then all those suspected VOCs or the cold fluid, that the needle may be warm, cold, and we want to warm it up. So they'll be left behind only, na? So try to